Okay, good afternoon, everyone. Thank you for joining us today. This is Lori Schaller. I'm the Manager of Financial Empowerment here at National Disability Institute. I work in the Assistive Technology Loan Program, and this is our orientation to give participants an idea of what we can provide loans for and how to apply for a loan. And we're going to be covering today the preparation of a spending plan, which is required for our loan application. Of course, individuals who complete that are not required to apply for a loan. So in submitting questions, or if you have technical difficulties, please put those in the Q&A box, and we'll be certain to reach back to you and help you through this presentation. Our vision here at National Disability Institute is that we have a society in which people with disabilities have the same opportunities to achieve financial stability and independence as people who do not have disabilities. In our mission statement, we collaborate and innovate to build a better financial future for people with disabilities and their families. So I wanted to share some new resources with you that are provided through National Disability Institute. So we have the Financial Resilience Center now, and you can find reliable COVID-19 resources around financial stability there. And so I invite you to take a look. We also have a license, a financial education tool that individuals are welcome to use to test your knowledge of financial management and also to learn more. And you can do that as an individual, or if you would like, you can do that, of course, with a case manager if you're working with a case manager in your community. And then I'm meeting people who are interested in financial counseling or financial coaching services. And at the FRC, we can also provide free financial counseling or coaching at this time. So if you want a safe place to talk about how to move forward with your financial goals, that can help you. And the links are posted below. So many people are interested in learning more about managing their own money effectively, improving their credit, and qualifying for loans so that they can borrow money at an affordable rate to be able to purchase something that they need sooner. So we prepared this presentation to help you understand what assistive technology is, how to select assistive technology, and options for purchasing assistive technology, or AT, and how to prepare a spending plan to reach your goals. I invite each of you to think of a goal that will take money to obtain or to purchase, and this presentation can help you to reach that financial goal. Of course, completing an orientation and a spending plan is important to the loan application process here. We want to make sure that people can afford the loan that they receive, so that when they're paying their loan timely, this is an opportunity for individuals who have no credit history to build a positive credit history, and those who are looking to improve their credit to be able to increase your credit score. So we received funding for this program back in 2014, and we provide referrals. We provide assistive technology loans and financial education in the communities of New Jersey and New York State. Our loans range from $500 up to $30,000. For residents of New Jersey, the interest rate is 4%. For residents of New York State, the interest rate is 6%. And we work with financial institutions to offer these affordable loans to people who need to purchase assistive technology. So, for example, we pay the bank each time someone receives a loan to lower the interest rate so that it's more affordable for the borrower. And in the event the loan should default, we back up that loan and we pay that financial institution. So what is assistive technology? It's anything that can help a person with a disability perform an action that a person without a disability can typically do. And this is for seniors and veterans. And, you know, over time, we all acquire some type of disability. So assistive technology, we're using it every day in our workplaces now. It could be our smartphone, our computer, but it can also include things like hearing or vision aids, smart home systems, stair climbers, standing wheelchairs, pedal wheelchairs, home or vehicle modifications, adaptive recreation equipment, business equipment, and can be as simple as having a working bathtub. Okay, so we're going to pose some questions here for you today in organizing today's presentation. So, will assistive technology vendors sell you something you cannot afford? Yes, in many cases, a vendor is happy to sell you something that you cannot afford, or maybe will not even help you in the way you had hoped that would help you. So at our website, we have 2 resource guides for assistive technology. One is for New Jersey residents, the other is for New York residents. So you can learn about different assistive technology demonstration sites where you can try out assistive technology before you purchase it, where other sources of grants or funding may be available to reduce maybe the amount that a person needs to borrow or to eliminate the need for a loan. So can you try out assistive technology devices before you buy them? Yes. There are AT demonstration events being held in New Jersey and New York, and now they're being held virtually, but it may be able to help you to save money on used or refurbished devices, and your AT center can help you to locate these resources. And prior to offering these loans, we did research, and most people said they had accidentally purchased assistive technology that wasn't working for them the way they had hoped. So again, we really urge you to take your time in finding the right assistive technology that best meets your needs. The link to those resource guides is posted here below. Will an employer, school district, vocational rehabilitation agency, or insurance company help pay for assistive technology? Yes, in some cases they will. So again, the link to our resource guides is posted here. So if a person is attending school regularly, the school district may be responsible for providing assistive technology devices for students with disabilities. That need needs to be documented in an individual education plan, and parents are encouraged to participate in those meetings with your school district. The unfortunate thing, though, is when the school district purchases the equipment, they own that device, and prior to COVID, in many cases, they would not allow that device to go home for use on homework or whatever. So in many cases, parents were approaching us so they could buy a second unit that their youth could use at home to meet their need. And of course, you know, the school district decides what type of device to get that they feel will meet that student's needs. So health insurance may pay for the cost of some AT devices too. So for example, here in New York State, I'm seeing many more insurance companies that are covering the cost for purchasing a hearing aid. So if you need a hearing aid or a vision device, you want to ask your insurance company, would they purchase that for you? Usually you have to have a prescription from a doctor and a report from a specialist such as a physical therapist or speech-language pathologist or an occupational therapist indicating that you need that particular device. But again, insurers may pay for devices, and they may have a schedule, for example, how often they will pay for a pair of glasses or a particular vision device. Then individuals who are interested in employment and they need that device for their job or within their education towards employment, the state vocational rehabilitation service agencies, the Commission for the Blind, and the Department of Labor may purchase assistive technology devices for individuals who have employment goals. So in New Jersey, that unit is called DVRS, Division of Vocational Rehabilitation Services, and there's the New Jersey Commission for the Blind and Visually Impaired. In New York, there's Access VR and New York State Commission for the Blind. Again, like other funders, in many cases, they'll choose what they feel to be affordable in terms of their expenditure towards purchasing assistive technology. So these, in many cases, assistive technology can be expensive. And you may need assistance through loans, grants, crowdfunding, churches, local groups, and you may even need to consider insurance for loss, theft, or damage of assistive technology that you would purchase. If an individual with a disability incurs home modification expenses related to medical or employment purposes, some or all of the cost may be deductible from federal income tax as a medical expense. So you want to talk with your tax preparer and ask if any expenses you've had related to your disability this year you may be able to get credit for when you file your taxes. So there are also work supports that can help individuals who receive SSI and or SSDI because of their disability through the Social Security Administration. So there are different work supports for the person who receives SSI, then for the person who receives SSDI, but in some cases people receive both benefits, so then they may be eligible for both sets of work supports. So there is a work support called a Plan to Achieve Self-Support, or a PASS plan. This allows an individual with a continuing disability who is eligible to receive SSI because they have less than $2,000 in countable resources set aside, and they have additional income towards a short or long-term employment goal. Their savings can be used to purchase assistive technology to pursue education, engage in business development, and increase employment outcomes. And for the PASS plan, someone could receive SSI and or SSDI, but like I said, they need to have less than $2,000 in countable resources unless, let's say a person just got an inheritance, they can put that inheritance into that PASS plan, and then it's a protected resource towards their financial goal. And what this PASS plan allows is for that person who receives SSI and or SSDI to stay in pay longer because they are paying out of pocket for the assistive technology or expenses that they may need. And this process of applying for a PASS plan can take maybe up to 3 months. So you want to start that process as soon as possible. So there is also the impairment-related work expense, or an IRWE. The purchase or lease of assistive technology for employment may qualify as a work-related expense, reducing the countable income for an SSI and or SSDI beneficiary. And for those who want to set up their own business and receive SSI, they can purchase business equipment with guidance regarding the purchase essential to self-support. And the information is posted at the Social Security Administration on how to pursue that. So that is not a countable resource. So you are allowed to have additional, for example, savings to meet your business goals. And then there's something relatively new. In 2014, Congress passed the ABLE Act, which provides a way for people who have had a disability that began prior to age 26 to save money in the ABLE plan that they choose, and they can even invest that money, and the investment earnings is not countable income. Both the state of New Jersey and New York have their own ABLE savings accounts, so you can explore that information at the ABLE National Resource Center.org. A person who opens an ABLE account can ask family and friends to contribute directly to that account, and they can save up to $15,000 in that account. And even a special needs or a pool trust can contribute money to that individual's ABLE plan. And then the person who works from their earned income, they can deposit additional money up to $27,490 into that ABLE account this year. So, and an ABLE account is allowed to use those funds to purchase a home, to purchase food, but more importantly, perhaps for you today, assistive technology, or to make a home accessible, things like that. So should family members be included in discussions regarding the spending of money? Well, we suggest yes, because everyone in the family, of course, has things that they want that are going to cost money. And knowing what each person needs is important to planning for purchases, and working together towards financial goals can help reduce stress around money management. And can a spending plan help families know how much they can save and afford each month? So yes, when a household lists all of their monthly expenses and then all of their monthly income, they can see how much money they have left over at the end of each month to afford what they need and what they want. So, for example, if someone wants to purchase something that costs $2,000, and they're going to save for that, or they're going to pay for that over 2 years, that person is going to need about $84 left over at the end of each month without changing like other expenses, so that they can afford to make that payment on time each month. So we invite you to prepare a spending plan. Until I worked at Consumer Credit Counseling Services, I had never prepared a spending plan myself. When I started to work there, I could see how it really helped people to know how much money they had towards their financial goals. And now, every single year, I prepare a household spending plan, keeping in mind what my new savings goals are for this upcoming year. So I know, for example, how much of my take-home pay I need to keep to pay for my monthly expenses, and how much of my take-home pay I can save towards my retirement. So that link is posted here in the chat box, and it's also posted within our loan application and as an extra resource at our National Disability Institute Assistive Technology website. So everybody's spending plan is going to look a little bit different. This is sort of an idea of what it could look like for someone, for example, who has paid their mortgage in full. Maybe they no longer have a monthly payment. But you can go on down the list. And we'll do that together, and we'll provide some referrals that might help you to save some money to be able to reach your financial goals. So usually a spending plan is listed in terms of priorities. So the first thing to pay each month is rent or mortgage. But there's flexibility in this too. So for example, for me, lots of times I spent more money when my kids were young on their recreation, so they learned skills that they could then apply in with their future employer. So there, again, this varies from individual to individual. So when you're taking a look at your spending plan, put in there what you pay for your rent, your mortgage, or trailer rent. If you're concerned that your monthly payment is more than 30% of your income, you may want to explore different resources that help to cover rent or an opportunity to refinance a mortgage. In many cases, now with COVID-19, lenders are being more flexible in terms of lowering the interest rate, but that individual who refinances has to be able to demonstrate reliable income from month to month. So if you have concerns that your interest rate is high, if your house is maybe worth less than your actual mortgage, or if you just lost your job and you're worried about making your monthly payments, there is help here at this HUD website posted below, and that's free counseling services. So if you need a home modification, you may be able to find home modification funding through a housing and urban development. So again, contact your local HUD office or your county Department of Health and Human Services. There are also grants for weatherization if you need insulation, a new heater or air conditioner, or even in some cases they'll replace a furnace unit or help with wood for a wood stove even. These resources are listed in the NDIAT resource guide as well. Household repairs. It is important to perform regular maintenance on a house. So put in here, if you figure you spend maybe $1,000 a year on fixing your house up, maybe you want to put in like $88 or $100 each month to plan for that, so you have that money set aside each month. Property school taxes. So I never included that in my mortgage payment, so I add up all of my property taxes, divide by 12, and that's how much money I set aside each month in my checking account so that when those bills come due, I can just write that check out in full to pay my school or property taxes. And you can reach out to your local assessor to see if you might be eligible for a program to reduce your school property taxes based upon income and age. And then there are utility assistance programs. So it's a lot easier to budget for utilities when we pay the same amount each month. So you can call your utility company, ask for a budget balance billing plan, and so instead of paying like $500 a month in the winter and $10 in the summer, maybe you would be paying like $100 each month every year. It's easier to budget for. And there is the LIHEAP program available to help cover utility bills. And if you live in New York State and receive SSI benefits and you're struggling to pay your utilities, you can call your utility company and ask about the SSI guarantee program, and they may be able to help you. So groceries. Grocery costs have gone up significantly, I would say, but USDA is stating that on average, a household spends $327 a month on food for one adult. So you might want to keep receipts just to see what you're really spending on groceries and takeout meals, things of that nature. So put in there what you need. If you receive food stamps, that goes in the income side, and you just put in here what you pay out of pocket for groceries. And I'll help you if you're actually applying for a loan to complete, this monthly spending plan, because we want to make sure you can afford your monthly expenses in addition to a loan payment to be able to purchase the assistive technology you wish. So insurance, add up all of your insurance policy premiums for the year. How much do you pay out? Divide that by 12, and then you can start to save that money in advance each month as well. So medical expenses. Right now there's open enrollment, but open enrollment continues for anyone who has recently lost their job, for example, and their income is low. You want to see if you might be eligible for free Medicaid, and there is no resource limit for that type of Medicaid. When Medicaid is associated with SSI benefits or is supplementing Medicare for those who receive SSDI, there are resource limits. But there's a link here where you can go to www.healthcare.gov to learn about medical insurance available for everyone now. And if you are working and receive SSI and or SSDI, there are special Medicaid programs that continue to cover you, or you may become eligible for a Medicaid program called Medicaid Buy-in for working people with disabilities. And that can help you pay for your Medicare premium each month. So it's an easy way to save money by simply working a couple hours even each month. And you can learn more about that through a benefits planner at choosework.ssa.gov. And a benefits planner is called a CWIC or a WIPA. So telephone, cell, cable, or internet, you may be able to call your companies and let them know that you have a disability, and they may have special discount programs for individuals who have a disability. If you have a vehicle lease or loan, please enter the amount that you're paying each month for that. If you've already gotten a loan for, let's say, a modified vehicle and the interest rate is too high, like I'm meeting people, they have interest rates of 18 or even 30% for a vehicle purchase, we may be able to refinance that down to the 4% or 6% interest, and that could easily save you, I don't know, $30,000 just on that one vehicle loan. So please give me a call after this presentation with any questions that come to mind so we can talk about your specific situation and help you to move forward. The average cost of auto repairs can be very difficult to predict, but you can find reliable vehicles at the newsroom at AAA, and you want to see what they have to report regarding the average cost of repairs for vehicles. So by purchasing, for example, a reliable vehicle, whether it's new or used, can save a great deal of money. So many communities have clothing closets where clothing is either free or at a reduced cost, and also there are food pantries available in many communities. So any type of help that you may need, you can call 211 and tell that person what help you need, and they will give you local resources in your community. If you live in New York City, you can call 311 and they will inform you. And the National Council on Aging has a neat benefit checkup. So when I completed that, I learned about other transportation services, for example, I did not know existed in my own community here. So you're free to explore this. This recording and the slides will be posted at our website, so you can always view this in the future. So child care or adult daycare, put in there how much you may be paying. Again, if you have those expenses, let your tax preparer know. You may be able to get a write-off for those expenses. Tuition after school activities and education. The Christopher Reeves Foundation offers ideas on recreational events, for individuals who have disabilities. So you might want to explore those resources. Child support, alimony. So if that's coming directly out of a person's pay or out of a person's benefit, you can put 0 in here. If you pay out of pocket, then you could put the monthly amount that you pay towards that expense. Personal care and entertainment. So do you have expenses for things like haircuts? How much are you spending on average per month? So I haven't been there, of course, since March. So I'm maybe going to spend $10 or less a month, maybe $5 a month I could put in my budget this year for haircuts. What does your family do for entertainment? Well, we're not going anywhere anymore. So this year we were able to save additional money because those costs went down. But like I said, our grocery expenses have gone up. So preparing this spending plan can give you flexibility as you see a shift in some expenses. If you want to do this another time in a different format, we have a class that you can register for at National Disability Institute, and the link is posted here. It's available at our website. So how much do you spend on doing laundry? Sometimes even purchasing like a washer and dryer may be a good way to start a credit history, and it can help you to save money over expenses going to a laundromat, even though your utilities may go up a little bit. But there are money-saving ideas for laundry posted here. And reading material. So maybe you have a magazine subscription. You want to include that in your spending plan. Maybe you have a pet. If that's a service animal, again, if you have expenses for that animal, let your tax preparer know, and you may be able to get some tax credits again for those expenses. Gifts. So how much do you spend total for the whole year for birthdays and holidays? Take that amount, divide it by 12, and you can start saving now for those expenses in the future. Alcohol, lottery, tobacco, if you have expenses for those things, you can put it in your monthly spending plan. If you're concerned about signs of addiction, there's a link here that you can explore for resources to meet your concerns. And perhaps you make donations to your church or a favorite charity. Divide that annual amount out and then put in a monthly amount into your spending plan so you can set that money aside each month. Okay, and then rent to own. So I'm hoping no one is doing rent to own. In many cases, a person easily pays 5 times more than what they need to by doing a rent to own. In some cases, the contract allows a person to return that device, but in some cases, if you return it before the end of the contract, you may still owe on that, even though you do not have that, whatever that item is. So, and I find often that these rent-to-own entities do not report payments on a credit report. So even though you're paying so much extra money through a rent-to-own company, it's not helping you to develop a positive credit history unless they repossess whatever you had borrowed from them. So do you have free checking and savings account, or do you have monthly fees? If you have monthly fees, you might want to look around and see if another bank offers free checking or savings account to help you save money there. And in some cases, they'll even pay you $200 to open an account with them and to move your money over. So emergency savings. I'm hoping everyone is able to save money for those emergencies we're not anticipating, and you can enter that into your spending plan. Okay. Are people who receive SSDI or SSI benefits allowed to work? Yes. SSI and SSDI beneficiaries are allowed to work to their full potential and use Social Security Administration work incentives to help them increase their income while keeping some or all of their benefits for at least a period of time. So to learn about that, you can go to choosework.ssa.gov. And for youth, this is like youth age 14 to 24, you can learn about the SSI Transitional Youth services that are available, and there's even a student earned income exclusion work support so that youth under the age of 22 who go to school can keep all of their SSI for the most part while working and keeping all of their earnings too. So SSI does have a savings and asset limit, but there are work supports available even by other service providers other than the Social Security Administration. For example, HUD offers the Family Self-Sufficiency Program, where an increase in rent, that money is set aside, and when the person reaches their financial goals, they get their money back. In many cases, there are individual development accounts available in communities to help people purchase a home, start up a business, or pursue education. We talked about PASS, and we talked about the ABLE savings account as well. So Social Security Administration has additional information posted here at the link below. So we've now listed all of our monthly expenses. Now list our income. So this could be from retirement, from our SSI or SSDI, from our employment, from alimony, from child support. You don't have to include that unless you choose to, but in most cases, people need to include those sources of income so that they can afford the loan. So I meet many people when they file their taxes, either because they have taxable retirement income or taxable earned income, they're getting more than $500 back when they file their taxes. So I urge you to consider changing your withholdings so you have more money to work with every single month. And the IRS has a tool to help us figure out how to change our withholdings. Or like when I go to meet with my tax preparer, I ask how I should change my withholdings for the next year, given what I anticipate to be earning and how taxable wages are calculated. And that gives me more money that I can set aside at this time, for example, towards my retirement. And there are free tax preparation sites located across the United States where, again, you can save a bunch of money. I guess on average it saves people maybe $300 to $500 to go to a free tax preparation site. When you get your tax refund, if you have an ABLE account, you can deposit that directly into your ABLE account. And then, of course, you can choose when you wish to spend those monies on qualified disability expenses from your ABLE account. So to find your free tax site, you can call 211. If you didn't realize and you've been waiting to do your taxes and you've got a couple years of refunds to do, you can have up to 3 additional years and 2020 taxes done at one of the free tax preparation sites by calling 211 to find your local site. So if you rely on someone else to help you pay your monthly bills in the household, give me a call. Let's have dialogue to see whether or not that person should be listed on your loan application. And again, my number is 202-449-9521. Thanks. So when applying for a loan, I want to see copies of what your income is, a way to prove that. So at least maybe your last 3 pay stubs. If you receive Section 8 benefits, that Section 8 award letter, maybe you have a retirement statement, how much you have dispersed on an annual basis or monthly from your pension or retirement plan, SSI or SSDI award letter for the year, the SNAP benefit award letter. And of course, many people who are applying for these loans do not receive any type of public assistance. But we need to see a reliable source of income that you can afford, to pay the loan back. And if you wish to set up automatic payments from your checking account to our servicing bank, you can set that up, and you would just send me a copy of a voided check. And all that information gets faxed to me so that we know that your personal identifiable information is secure. So question 7 here, can banks, landlords, employers, insurers, and credit companies review your credit report, in many cases without your even knowing it? Yeah, so you may have signed a bunch of paperwork when you applied for a job, and in there they could have said, is it okay if we take a look at your credit report? And every time you call for a new insurance product, maybe you want to rent an apartment, in many cases, a person's credit report is being pulled. So you probably want to know what other people are seeing on your credit report. Do banks only look at applicants' credit report scores for loan approval? No. Most financial institutions look at applicants' education, reliable income, expenses, extra money saved, assets, credit available, and the amount of credit being used on a monthly basis, including the credit score. So for our loan program, a person does not need, for example, a credit score. This could be a way for a person who's age 18 or older to develop a positive credit history. So I have a couple samples here of where you could order a free copy of your credit report or learn more about improving your credit score. So we've got annualcreditreport.com. We have creditkarma.com, which would also provide you a record of your credit score. And we also provided guidance on how to dispute items that you think you no longer owe that maybe are posted on your credit report, so you could fix those sort of things up. But remember, the free financial counseling or coaching services, that individual too can help you to move forward with your goals for improving your credit score. So when we pull a credit report here at NDI, we pull a soft pull, so it does not lower a person's credit score. But usually, like if you go to a car company to purchase a car, they'll do a hard inquiry, and each time somebody pulls your credit report, it can lower your score. So an open line of credit is the total amount available for you to borrow, and the amount you have borrowed can improve or lower your score. So like when I had no score, I all of a sudden, I was trying to develop a good credit history, and I got all these credit card offers. I said yes to a bunch of them, and then it looked like at any given moment I could walk away with tons of money. So then it was hard to get a loan because I had too many open lines of credit. So we all learn from these experiences, so I had to close some of those lines. But the longer we keep a particular line of credit open that we pay regularly, that can help us to improve our credit score. Can a creditor list a debt on a credit report for more than 7 years? In some cases, yes. Accounts show payment history for the period they are in use and 7 years from the date of delinquency or payment in full. A judgment for an account can be posted for 10 years and can be renewed. There's been some suspension of judgments, but to be honest with you, when I'm pulling credit reports, I often see the judgments posted, so I think this is still being worked out. But in New Jersey and in New York State, there are statutes of limitations of 6 years. If a judgment is not in place, that person, if they have not made a payment in 6 years or longer, they may no longer owe that debt unless it's something like child support or a student loan, for example. So credit report listing of public records. Utilities, child support, and tax accounts usually do not show up on a credit report unless they are in collection status, and you can prevent collection activities from damaging your credit. If you receive a notice of a court date regarding a collection, you can go to that hearing and negotiate a repayment plan in an effort to prevent legal action. And legal action can include posting a judgment for child support, tax, and or credit accounts, which does significantly lower a person's credit score. And I understand it's temporarily on hold, but like I said, I see these things yet being posted. So how long is a bankruptcy posted on a credit report? Chapter 11 and 7 bankruptcies are posted up to 10 years, but when I apply to sell insurance here, when they did a background check for me, they could see other people who had filed bankruptcies years before that they had done so, and in many cases those individuals were not able to receive a license to sell insurance in the state. So having a bankruptcy can interfere with obtaining some licenses for jobs. If you have filed bankruptcy, there is a 5-year waiting period before most mortgages or the assistive technology loan application can be approved by a lender following bankruptcy. But give me a call, because maybe I can help you to find another source of funding to be able to purchase the assistive technology you need. I hardly ever issue any loans because we're trying to help people find funding in their community to purchase the assistive technology they need. So wise use of credit. Open a checking or savings account. It's a first step towards building a potential credit relationship with that financial institution. And it can help you to save money over using other predatory services such as a checking, cashing, or payday loan services. Now, If you have had an issue with your checking account, there's something called a second chance account. So you can go to a bank, ask what you can do to be able to open a second chance account, and they'll help you walk through that. Having a loan for college is a way to develop a credit history and advance your education and career. Sometimes purchasing an energy-efficient appliance with a line of credit can help you to save money. And for those who pay rent or utilities, you can ask that your timely payments be reported to your credit bureau to help you develop a good credit history simply by paying your utilities or your mortgage or your rent on time. And so if you go to a store regularly, you might want to ask if they offer a line of credit. And if you borrow money, try to have a goal to pay that back within 30 days. So when they send you that bill. So with the spending plan, you may be able to do that other than for large purchases like a vehicle or assistive technology that might cost $2,000 or $4,000 or $8,000 or $30,000. So the best way to improve your credit is to pay all accounts in full as agreed. So if you're supposed to pay a monthly payment each month, to pay that monthly payment on time each month. And then if you owe several accounts, by paying the minimum to the lowest interest accounts and paying more money, the rest of the money you have left over the end of the month, to the highest interest charging account can help you to save money. When that account is paid in full, you can move on to the next highest interest account. Okay, settlement. Sometimes if like you get an income tax refund or if you've got extra money, you can call a creditor that you still owe money to and say, look, I can't afford to pay you the full amount. Would you accept maybe 50% of what I owe? Before you send that payment in, ask them to send you a letter indicating that they will accept 50% as payment in full and update your credit report. And then make a photocopy of that letter and send your payment in with that letter. So Credit Report Review, the National Federation of Consumer Credit Counseling Services offers credit counseling services. And again, AFCPE is offering free credit counseling services at our National Disability Institute website. So feel free to take a look at those things. Question number 10, if a person has a loan for $1,000 at 0% interest, could they owe more than $1,000 if they don't pay anything? Well, yeah, they're going to end up probably owing late fees, maybe $30 each month. If that, let's say it's a vehicle, it's repossessed, they could owe repossession and storage fees, auction fees, maybe the auction bid, they're only going to get $250. So that person who borrowed only $1,000 could easily end up owing $480 more by not paying on a line of credit. So that's why knowing what our monthly expenses are, what our monthly income is, adjusting where we can help us know how much we can afford in the future. So steps to consider for the loan: bring all your monthly bills current, make timely payments to creditors, pay off your highest interest accounts first. That's the way to save you the most money when repaying creditors. Bring your child support payments current or have a repayment plan in place. Negotiate income-sensitive repayment plans to student loans. Save for purchases and pay back within 30 days when you do use a credit card, for example. And save some money for a down payment, perhaps, towards your assistive technology. That makes it easier to approve your loan application because we can see that for like 2 months now, you were able to save $30 each month. We know then that you can afford a loan payment of maybe $30 a month. Limit additional credit. So if you're in the process of applying for an 18 loan now, you wouldn't want to apply for other credit at the same time. And once you get this loan, you probably want to concentrate on paying this loan back before getting another line of credit to ensure that you can pay this back. So we have a loan committee. When you tell me after we've met that you're ready for your loan application information, a summary of that information to be considered by the loan committee members who each have a disability. 50% have a disability in themselves. In fact, it's a higher rate than that. They decide whose application is pre-qualified, and they all must agree, and in some cases they're providing referrals too where they think the person could save money. So what does the loan committee consider? Proof that your housing expenses are current, monthly expenses are current, what your total income is, what your credit score is, or your repayment history, what assistive technology you need if you were able to save money towards that, and write a personal statement to the loan committee telling them not your name and personal information, but why you need this assistive technology and how you feel it will improve the quality of your life. So if you already purchased, let's say, assistive technology at too high of an interest rate, let them know that you want to save money, that this is costing you too much money and you want to refinance. You need that assistive technology, but you want to refinance now to save you money so you can afford other expenses in the future. And just to give you an idea, we put together this comparison chart. So let's say, somebody wants to purchase something that costs $10,000, and that assistive technology vendor, they offer financing. In fact, it only takes 5 minutes to get a loan from them. But they may offer the loan at 16 or 30% interest. So that person's monthly payment is like $243 a month. That's 16% interest. I've met one vendor that urges people, okay, we'll give you a line of credit for $5,000, put the other $5,000 on your own credit card already. Well, that would be 24% interest. So then that monthly payment is $287 a month. But if you come to us and the interest rate is 6% or 4%, your loan payment on $10,000 loan is going to be $193 or less each month. So you could easily save $3,000 on a $10,000 purchase over a 5-year term. If that AT vendor stretches the term of the loan out even longer to make the loan payment more affordable for you, it's going to cost you more money in the long run. So, how long does all of this take? Some people, like today, they'll complete the loan application. They'll call me later this afternoon. We could review their loan application. We could submit this to the loan committee probably tomorrow then. And then if pre-qualified, the loan application then is faxed over to the bank that could issue a check to the AT vendor within a day or two. This process is very quick, but I urge you to take your time to find the right assistive technology that's really going to work for you. So we have at our website a fact sheet that takes me 5 minutes to read, instructions and the checklist, maybe 20 minutes to go over. Researching, you can take your time, like I said, complete the orientation and spending plan. You might already have that done today following this presentation. You're going to complete the loan application, fax it on over to me with a photo ID, your Social Security card, proof of income, and that your monthly expenses are current. We'll set up an intake appointment, and we'll look at your credit report together. Many people have never looked at their credit report, so I'll inform you what is seen on your credit report, what steps you may want to consider to improve your credit. And then, like I said, we're calling the loan committee meetings as soon as someone is ready to get them the assistive technology that they need. But we have this policy that if we get way too busy, we have up to 2 weeks, but we've never needed to wait that long. So if you apply now, we could easily, hopefully, have a loan in place for you for assistive technology purchase for the holiday, or adaptive equipment that you want to purchase for your child for the holiday. whatever you need, we can have it in place soon. So I urge everyone to reach out to me personally. I am available this afternoon. I'm usually here in the office from 8 until 5, Monday through Friday. So you can call me at 202-449-9521. And my email is posted here. And of course, all my contact information is at the National Disability Institute website as well. So I have included the AssistiveTechLoans.com website information too, so you can print out a loan application and feel free to give me a call. I really want to thank everyone for participating today and hope you have a great day. Thank you. Bye-bye.